Kaplan is my guest with the Tennessee chapter of the Crohn's and Colitis Foundation. Kim actually shared with me and is sharing with us that you're actually a patient that wanted to get involved with the organization, ended up getting a job.
That's right.
And involved with this fundraiser that you do coming up in June.
Correct. Correct.
Okay.
It's the Take Steps Walk. It's the largest fundraiser that we do to try to find cures for Crohn's disease and ulcerative colitis.
How prevalent? This is an illness that I've heard more and more about in the last few years because I've met people, I've heard about younger people who are diagnosed, which it's typically when people are, what, around 15 up to in their 30s? Is that the typical time of being diagnosed?
That's the typical time, but the thing with these diseases is they do not discriminate. So we've seen patients as young as 2 months old, and we've seen patients into their elderly years. So
wow.
anybody can be affected by Crohn's or colitis.
Do we know, do you understand, do the scientists know what causes this, what triggers this? It's an inflammatory process, right?
Correct, correct. So Crohn's disease and ulcerative colitis, they are both diseases of the digestive tract. The main difference is that ulcerative colitis is contained within the colon, and Crohn's disease can occur anywhere from your mouth to your anus. And as far as what causes them, though, we don't know, which is why we are raising funds to find a cure so that we can get to the root of these diseases.
It's not, well, you think with your digestive system, oh, it's the way I'm eating, or I'm not taking care of myself, I'm eating bad foods. That does not cause it. It can help
Correct.
control it, though, right? When you...
There's a thought, yes, that changing your diet may help to control the disease, but because we don't know what causes it, we don't really know. There's medications that can control it, but as far as if you eliminate a certain food or things of that nature, we don't know yet.
Do we see this, does the community see this, that studies it, and gastroenterologists, does it run in families? Is it are you genetically predisposed?
There are some patients who it's found in their families, and then there are other patients we deal with who have no connection. So that's another one of the things that we're trying to figure out.
Makes it so tough.
It does, it does.
So what are the symptoms? I know it's a very difficult illness to live with.
It is. Abdominal pain, severe abdominal pain, rectal bleeding, frequent diarrhea, extreme fatigue. Those are some of the common external symptoms, and then our patients can have other symptoms too, problems with their eyes, arthritis. So it kind of runs the gamut.
With the debilitating fatigue, would that have to do with you're depleted of a lot of vitamins and nutrients because of losing so much of that? And
that's part of it, and it's a chronic illness. Your body is trying to fight this illness. So.
Okay, so walk me through getting diagnosed, getting to that point. I assume most patients like yourself started out with your family doctor and then ended up with a specialist. Is that
correct? My family doctor sent me to a gastroenterologist, and then they did a number of tests. One of the most common is a colonoscopy that gastroenterologists will do, where they can actually see inside the colon and the small bowel, and they're able to see what's going on, if there's inflammation, if there's ulcers. And then they can take biopsies, and those biopsies are then looked at to determine whether a patient has the disease.
Okay, so once they identify you as having Crohn's, colitis, how do they treat that then? What are some of the modalities for treating?
So there are a number of good drugs available. We're fortunate that we've been able to do the research. Crohn's and Colitis Foundation is able to do the research, and we've been a part of coming up with a number of drugs to help treat the disease. There's what are called biologic drugs, which I think is the most common that patients are treated with now. And so the hope is that the physician finds a treatment that works for the patient, and they're on that, and that keeps them stable.
Has that really helped you as well, those kind of medicines?
They have. They have.
Good, great. I'm reading here in some of the notes, about 23 to 45% of people with ulcerative colitis will eventually, with Crohn's disease and ulcerative colitis, 75% of people with those will eventually require surgical intervention for their disease. So what would they do surgically?
I guess it depends really on how severe the disease is. They can resect portions of the bowel, whether it be the small or the large bowel. They can resect portions and remove those portions of the disease. And then some patients like myself end up having to get an ostomy because they don't have any other option, and they have to have, in my case, I had my whole colon removed in order to be able to survive and continue to battle this disease.
Wow, you've been through a lot.
I have
You've
been.
really been through a lot.
I have
so you
been.
know what you're speaking about. Wow. If these symptoms sound familiar to somebody listening, somebody watching us today, what should they do? Is there a resource, your organization, obviously?
Right. Well, first and foremost, talk to your doctor. You know, don't wait. Don't see if things will get better. If you've had persistent diarrhea, if you have severe stomach aches, call your doctor. Talk to your doctor. Let them send you to a gastroenterologist. And then our website is always a great resource, ccfa.org. And then our help center is 1-888-MY-GUT-PAIN, and that is our information resource that we have through the foundation where people can talk with specialists.
Okay, and also don't forget the Take Steps walk
Yes.
that you're promoting coming up June
3rd.
All right.
It's at the Centennial Park Bandshell, and we're going to have over 600 patients all gather together to raise funds and raise awareness for these diseases.
That's a lot of people.
It's a lot of people.
Well, that shows a lot of support, which is what you need to help researchers continue to look for causes and a cure.
Exactly.
Thank you so much for sharing the information and the story, and to get it out in the open.
Yes, and that's what we're trying to do. We need to raise awareness in order to raise the funds to find a cure.
Absolutely. All right, take care. Thank you very much.
Thank you.
All right, and we'll be right back after this.